Thank you, and good morning, everybody. Thanks for joining us again. I've got to tell you that this morning I'm extremely concerned about the trends in our case numbers. For the past 2 weeks, our numbers have been increasing in Snohomish County. This is exactly the wrong direction to be going, and I just have to urge all of you to keep wearing masks, keep your distance from others, especially those who have not been vaccinated. As we go into the Easter weekend, I know a lot of families and friends will be gathering and wanting to gather, but we are not through the COVID pandemic yet. We do not have enough people vaccinated to really stem the tide if we let down our guard. So over the last year, we've seen too many people get sick and die. We just really need to double down on our safety measures for a few more months, keep going, or otherwise we're going to see a spike. I understand that over 25 other states are seeing increases in case rates. We're seeing a third wave in many countries in Europe. We do not want that to happen here. You know, we've just had a phase 3 reopening. Our businesses are allowed to open up. I do not want to see a rollback, and I know you don't either. So we just need to, again, double down on our safety actions and just see this through. Please, let's not go backward yet. Our small businesses, our workers, our families, and frankly, the families that lose loved ones do not want to see us go backwards. We just absolutely need to work together to push the curve back down. So again, wear masks, even if you're vaccinated, keep your physical distance and limit your gatherings. It all works, we know that, so please keep it up. So as part of our efforts to beat COVID, our vaccination effort really has been one of the highest priorities we have lately, and we are getting out vaccines as fast as we get them. So we're making progress. We have put the facilities in place and the people in place to make sure that vaccines are delivered as we get them. So again, supply is the issue, not our ability to deliver them, but the situation's getting better. It just takes some time to get everybody vaccinated, or enough people vaccinated to really make a difference. One of our concerns from the very beginning was the challenge of reaching those in communities who really have impediments to getting the vaccine. It may be they do not have the technology, or not comfortable with online web-based scheduling, that type of thing. It may not have access to transportation, or there may be cultural or language barriers, and we know that. We've known that from the beginning, and we started very early to put in place plans to understand all those impediments and reach out to people that are affected by them. So it's really our job to make sure we're listening to all our communities and designing a vaccination program that can get to everybody. So after Dr. Spitters gives us his update this morning, Alessandra Durham, who works in my office and helps lead the Office of Social Justice, is going to be giving an update on our efforts to reach everyone in our community. Alessandra has been part of the COVID-19 response from the very beginning, and along with her Office of Social Justice colleagues, has really done a fantastic job ensuring we're doing everything we can to lower barriers to vaccine access, no matter what those barriers are and no matter who is experiencing those barriers. So this, as we get sort of the easy vaccinations done, it's even more important to make sure that we're reaching out to everybody and that we don't leave anyone behind. So with that, I'll turn it over to Dr. Spitters of the Snohomish Health District.
Well, thank you, Executive Summers. And yeah, I can only, most of what I'm going to say is a longer version of what you succinctly laid out, that case rates are up and we need to double down on these efforts to control the pandemic as we've been doing. I'm going to share my screen here and just show you all a couple of slides. And as you can see, things are headed in the wrong direction here. We appear to have bottomed out around 70 cases per 100,000 per 2 weeks. That would have been back through the 13th of March. Then on the 20th of March, that 2-week rate up to 72, and then through last Saturday, the 27th, up to 92. So that's about a almost 25–30% increase off of the bottom. And so things are indeed going in the wrong direction there. If case rates continue to climb, as Executive Summers mentioned, we could slide back to phase 2, which means resuming more restrictions on businesses and activities, and also just illness, suffering, and death. Even though we've adequately covered long-term care facilities and much of our older adults, the success in those efforts thus far is not enough to prevent all the hospitalizations and deaths that occur in folks that are not covered by vaccination, which is the majority of the population still. So we can reverse course quickly, but we need your help to do that and to keep us in phase 3. As Executive Summers said, mask up when you're around people you don't live with, indoors or outdoors. Keep that 6-foot distance, wash your hands. And I would say also with the upcoming holiday and just in general, non-essential gatherings, especially at a moment like this, we're so close, we're probably just a few months away from really putting the emergency situation behind us. We may always have some level of COVID to deal with in the future, but it's really premature to cash in on the success we've had thus far. So I really urge folks to really back away from non-essential activities that involve gatherings. So let's celebrate the upcoming holidays safely and wisely. Now, speaking of vaccines, let's just walk through. I want to give you an update on where we're at. This is through March 27th, so the end of last week. We had been distributed to Snohomish County providers over 320,000 doses, the vast majority of which have found their way into arms. If you, instead of looking at doses, look at people among Snohomish County residents, 213,000 people have initiated, that is, gotten their first dose of one or another vaccine, and 126,000 fully vaccinated, got both doses of the mRNA or the single dose Johnson & Johnson. So that's over a quarter of the population started, and 1 out of 6, 15%, fully vaccinated. So we've made a lot of progress, but we have a ways to go. This slide here shows each bar is the number of doses given to Snohomish County residents every day, and since the beginning of the vaccine campaign, and you see things have picked up. And right now we're averaging 4,000 to 5,000 doses per day countywide. So that's 30 to 35,000 doses per week. We, as Executive Summers mentioned, and we've talked about before, we hope and expect that to increase more up to around 50, 60,000 that would permit us to get this all done hopefully by August, or get most of the vaccine effort done by August. At the current pace, it would take likely until about October. Just to give you an idea of who's getting vaccinated, as you would imagine, based on the prioritization scheme of the phases we've been going through, older adults more likely to have initiated vaccine. Up above 50% of our residents over 65 years of age have started vaccination. Of about 34% of folks over 65 have completed vaccination. Next slide. Now, Ms. Durham's going to speak more about this, but this is just some data to introduce the topics that she'll be addressing and that Executive Summers mentioned. When we look across race and ethnicity groups and look at the proportion of the total population in each group that's been vaccinated, we see a range from 15 to 20% among most groups, with only about half that among Latinos. So there's some quite a deficit here. Now, some of that is due to differences in the population structure of different groups, and so I want to show you that it mitigates things a little bit, but not completely. If we look at, instead of the total population, let's use a surrogate for who's eligible to be vaccinated thus far. So if we look at folks over 65 years of age by race and ethnicity, as a rough surrogate of who's been eligible up to this point. Other populations have been, but just using that as a more fine index. Here in this column, we see the percentage in each group that has initiated vaccination. So most groups in the 40% range have initiated vaccination, and that's back through March 14, not through this current week. Native Hawaiians and Pacific Islanders, very small numbers, but also a very strong effort for those small numbers, reaching a larger proportion. And then again, we see the Latino group falling behind a little bit. It's about 38% versus 45%. That's roughly 8 Latinos getting vaccinated for every 10 non-Hispanic whites. So that's the main group we have concern about. That gap closed. You recall on the last slide, it was more like half. But because the older population, or at least the recorded older population in that group is small, that's why we see some of that difference. So again, overall, among all people over 65, we're off to a good start, but we've got quite a ways to go, and we're adding groups as well. So it's a challenge for us all, and it speaks to the importance of not only patients, but also thinking of others and taking your place in line when you're up, but no sooner, is my request of you all. And with that, I'm going to come back, make a few more comments here, but return us to our regular Zoom screen. And so the last thing I'd like to mention this morning is about Phase Finder. That was the Washington State Department of Health's web-based portal for determining whether you're eligible for vaccination, as I just mentioned. And the State Health Department has announced that as of tomorrow, Wednesday, March 31st, the Phase Finder tool will be shut down and will be no longer required as proof of eligibility for vaccination appointments. Now, without that tool, and given the variety of groups and classes that are now eligible based on health, age, employment, living situation, and with further expansions on the horizon, March 31st and beyond, it's really no longer practical for the Vaccine Task Force to perform spot checks of eligibility at the mass sites as people arrive for first dose appointments. So following the state guidance, we will rely on self-attestation from patients that they are currently eligible. The vaccination sites continue to be by appointment only, and people will be asked to provide verification that they have an appointment, as well as a form of ID to show that they are the person for whom the appointment was booked. If it is a second dose appointment, they should also come prepared with documentation of their first dose. If they've lost their vaccination card from their first dose appointment, they can download their vaccination record from this website that I'm going to post right there on the chat feature. And everyone is strongly urged to follow the phased approach to vaccination still. If you're not eligible, you should not sign up for an appointment yet. The demand for vaccine remains higher than the number of doses we are receiving. We have now several 100,000 people that are going to be eligible each week, especially beginning Wednesday as we expand further. And each week there will only be, roughly right now about 10 to 15,000 first doses. So you can do the math, but it's going to take persistence and patience for going in, trying to sign up, and eventually we want to, and we will get full vaccination for everyone who wants to be vaccinated in Snohomish County, but we can't get to everyone this week or even this month or next month. It's going to take probably 2 to 3 months minimum with an optimal vaccine supply, 4 to 6 months with the current supply. So getting vaccinated ahead of your turn may take an appointment away from someone who is higher risk than yourself. This includes elderly residents, individuals with multiple underlying medical conditions, and high-risk workers in congregate settings, many of whom still are seeking vaccination appointment. Eligibility continues to expand, and all adults are expected to be eligible no later than May 1. If you are not in the current phase, your turn will come soon. Please be patient, as appointment availability remains limited at this time, as I said above. So with that, I'd like to turn it over to Alessandra Durham to share more about the vaccine, what the Vaccine Task Force has been working on to increase access of vaccine to underserved and vulnerable populations. Alessandra.
Good morning. Thank you, Dr. Spitters and Executive Summers, for your remarks around equity and vaccine access. Over the past year, looking at the data in Snohomish County, we know that communities of color and other historically excluded community members have been disproportionately impacted by the COVID-19 virus in terms of higher rates of infection, higher rates of hospitalization, higher rates of mortality, unemployment, and a lack of access to resources. Their communities, as Dr. Spitters highlighted earlier this morning, have also disproportionately received less access to vaccines. With the support of Dr. Spitters and Executive Summers, the Office of Social Justice, Department of Emergency Management, Snohomish Health District, and the Vaccine Task Force have been working together to meet with key community leaders, evaluate the reasons for this disproportionality, and to create an informed plan using data and community input to ensure all Snohomish County residents have equitable access to the vaccine and other resources. Through evaluating data and meeting with the leaders, our teams in partnership with the Vaccine Task Force have learned that there have been several reported incidents where community members have been charged high administrative fees by pharmacies when they don't have access to health insurance. It's not an allowed practice, but for people who aren't aware of how the system works, this can be a deterrent for accessing vaccine services. We've also learned that current and historical abuses and experiments by the healthcare providers and other systems have created strong mistrust in communities of color and other marginalized populations. Another barrier that we're hearing about often from our community members is lack of access to reliable transportation to and from vaccine sites. When people are reliant on public transportation, it can make it incredibly difficult and time consuming, especially when they have children and other priorities. Oftentimes people also find that in order to use these mass transit services to get to vaccine sites, they miss out on time away from work and lost pay. Childcare has also been a common theme in terms of why many of our marginalized community members aren't being able to access the vaccine services that are currently available. And again, when you lack access to personal transportation, going to drive-through sites and other similar setups can be difficult for folks. So hearing these challenges that our community members and leaders are reporting to us, we worked together in partnership with them to determine how we could open up access and ensure that, again, our whole community receives the same or equitable access to what we have to offer. So in the last 2 months, Snohomish County DEM, the health districts, and the Office of Social Justice have provided 400 vaccines to Providence Regional Medical Center in Everett for the express purpose of providing vaccines to individuals of color and community members from other historically excluded communities that were eligible under Phase 1A and 1B1. Additionally, the Vaccine Task Force and our collective offices worked together to provide 1,700 doses on February 15th to our broader community, ensuring that BIPOC and other historically marginalized community members had access to that site as well. That resulted in several hundred members from our community being vaccinated at that time who were eligible but wouldn't have otherwise had that same access. We are also working together to create a community-based mobile program in which we go out to the communities that have been hardest impacted, but again, have had trouble accessing the vaccines to ensure that it's easy and fairly seamless for people to get to. That will be launching within the next couple of weeks. We are also working together to create a community advocate program in which members of the community work to serve their fellow community members by providing culturally appropriate education around the virus and the vaccine, as well as helping individuals that may have barriers to registering and getting to appointments, registering and transporting them there. Additionally, we're also working together to ensure that when there are vaccine appointments available, that we are communicating that efficiently to community leaders so that they're able to communicate that to their fellow residents and ensuring that they're able to access those appointments before they're gone. As we know, when you have access to the internet, they go pretty quickly. And lastly, none of this work could happen without partnerships with community-based organizations. So as we roll out that community advocate program and the community-based clinics, we'll be working with several organizations that were created by members of the community and serve members of the community. And with that, that concludes my remarks.
Great, thank you, Alessandra. So we'll jump into questions. I guess for Dr. Spitters or I, would either of you like to see the vaccine eligibility for all move up from May 1st? Doctor, would you like to take that first?
Sure. You know, there's no easy answer there, and it's not really, it's not a local decision. I think we'll work with our neighbors and with the state around this issue of when's the optimal timing to open things up. There's some inefficiencies and risks to waiting till May 1 or some date beyond that. And then there's also implications for the sooner we do it, there's costs there as well. And so I think it's just finding the right spot. I think the main idea is that we got plenty of people right now who are interested in being vaccinated, and many more than supply. So I'm not in a big hurry to go there, but if it makes sense to go there sooner, then I'm on board with that.
I can't really add to that. Thank you. Seattle was on the verge of closing down major testing sites with a last-minute decision not to. Has Snohomish County considered something similar, and why or why not? And if so, which testing sites might be shut down? Doctor?
Yeah, well, we're always looking at how we're allocating our resources for the end goal of, well, the approximate goal of controlling things and then getting out of this ultimately. And certainly testing is playing a lesser role now than it did many months ago. And, we're constantly looking at that. We have reduced, demand has declined, number of people seeking testing has declined. And as a result of that, we've closed down a site or two. I think the Everett College was closed down, and we might have reduced our presence in Linwood. And, just the numbers of people seeking testing, as I said, have gone down, both in our settings and countywide. Now, having said that, I think the reason maybe King County shifted its weight a little bit is because of what we see on the case rate lately. And not only is the testing a clinical service for helping people who have symptoms get diagnosed, but it's important for us for case finding, for containment efforts, as well as for surveillance and knowing what's going on. So, there is a Goldilocks space where you have the right amount of weight on vaccination and the right amount of weight on testing. I'd certainly put more and more weight on vaccination over testing if things were continuing to decline. But I think that the recent trend suggests that there's some merit in taking that slowly and seeing where things go before we deconstruct the testing system, and that we also maintain capacity to expand it if things continue to go up and demand increases.
Okay. Do you think the county is losing ground on a rise in case rates compared to the amount of people getting vaccinated? Doctor, do you want to start?
Well, I don't know if we're losing ground, but in essence, there's a little bit of a race going on between getting people vaccinated or enduring another wave of disease. And we're, the reversal of the decline in cases suggests that, the virus is catching up on that race. And, we want to beat it out, but we can't do that with vaccine alone. We also need people to really keep up 110% on the prevention efforts to buy us time to get enough vaccine coverage where the risk of another wave is forestalled.
You know, just add to that, as Doctor said, it is like a race, and our speed of vaccination is really determined by how much vaccine we get. That isn't changing. That's, you know, it's what we get from the state and federal government. So whether the case rate's going up or down, the long-term outlook of when we get enough people vaccinated really doesn't change. But clearly the virus is seeing an uptick, and that just has real life implications for people who will get sick with it, may die. And if we have to turn back the phases, are businesses that will suffer from it. So it's very real implications. We just need to slow the virus down while we continue to do everything we can to get virus or the vaccinations into people just as quickly as we get the vaccine. So. Dr. Spitters, can you give us your take on UW Virology's findings of extremely low incidences of flu in the area and what you think is behind that?
Well, that's right. You know, flu is virtually absent. We probably had a few importations here and there, but really there's been no widespread flu activity, even back with the Southern Hemisphere during their past winter, during our last summer, and then on through our winter up here. Just virtually no influenza activity, and that just is a result of all the prevention measures everyone's taking. Now you might ask, well, then why is COVID still circulating? And that's because, you know, COVID inherently is a little bit easier to transmit than flu. You know, I'd say roughly double, you know, and so it's what we're doing is good enough not only to interrupt influenza transmission, but also RSV, respiratory syncytial virus, which is a common cause of colds and severe respiratory disease in young children and infants. And many other respiratory viruses are virtually absent this year, just due to all the prevention measures we're taking. We just need to keep that guard up and keep COVID at bay for a few more months.
Next question is for probably either for Dr. Spitters or Alessandra. Tell us more about the pharmacies and high administrative charges to people of color.
I'm happy to take that one, Dave. So through the Office of Social Justice, the Executive's Office, and the Health District's Community Equity Advisory Board, we have very close relationships with our community leaders and community members. And we had experienced a wave of, there's a rate of $80 or $100 being charged for me to receive the vaccine. Should I pay that? I will say that through our partnership and relationship with the Health District and with the Department of Health, they've been incredibly responsive that when we do receive those calls, they reach out to the pharmacies to educate them or re-educate them on what the administrative process should be in terms of compensation for the vaccine. There is an amount that they can charge, particularly for individuals that are insured, but that bill would go to their insurance company rather than the individual. For individuals that are not insured, there should be no cost to them. So we've been communicating that message out to our communities. You all can be helpful in helping to share that with us as well. And that if you do hear of those instances, certainly report that to your local health jurisdiction or the Department of Health, and they do reach out to re-educate those providers.
Thank you. Okay, how does the county plan to vaccinate those incarcerated at the Monroe Correction Center?
Well, you know, state correctional facilities are sort of a unique entity. You know, they're multifocal throughout the state, say jurisdictions of the state health department. So Department of Corrections and the state health department, that ball is really in their court.
Okay, and Doctor, how many doses of the vaccine are coming to the county this week, or what's our current knowledge?
I don't have final numbers yet, but coming this week, yeah, it's about it's still working out the numbers, at least 25,000, but we haven't finalized all that with the state yet. but probably similar to the recent weeks.
And for Dr. Fitters, is there yet a determination regarding the recurrence versus reactivation hypotheses for COVID-19 that was being examined in a World Health Organization study early in the pandemic?
Yeah.
Are most people still recovering completely, and what is percentage of people who experience lingering illness?
Okay, there's a few questions in there. We'll kind of take them one at a time. One is, there's not the term reactivation, which might have been used earlier, is really better reserved for diseases that truly have a latent phase and then reactivate weeks, months, years later. Things like tuberculosis, some forms of malaria have that. Whereas COVID, people get it. They either get symptoms or they don't. Roughly 2 to 1. 2 out of 3 get symptoms, 1 doesn't, roughly. And then generally not infectious after about 10 days or so. But people can shed the genes, the nucleic acid, the RNA that the test detects for weeks and sometimes months afterward, but that doesn't correlate with infectiousness or illness. So sort of reactivation of illness is not something that I think has stood out over time. There are people with lingering symptoms out at 3-6 months after recovery. The estimates are roughly in the range of 1/3 to 1/2 of a variety of symptoms, but led by shortness of breath, chest pain, difficulty breathing when exercising or going up the stairs, cloudy head kind of feeling, and then a variety of other symptoms. But those are the two kind of leading ones that are present in up to 1/3 of people who have had symptoms, 3 months down the line. And reinfection would be the last thing. Recurrence, people recover, which is the vast majority, or people have a lingering illness, as you said, and then reinfection has occurred, has been demonstrated, but thus far is extremely rare. I think like a handful of confirmed cases in the state of bona fide, definite reinfection since the pandemic started. Now, as time goes on, we're likely to see more reinfection because duration of immunity is probably limited if what is true about other human coronaviruses is true with respect to COVID.
Getting rid of phase finder will certainly lead to more people jumping the line for a vaccine. What do you make of that decision as opposed to just operating eligibility to, or opening eligibility to everyone ahead of time?
Certainly lead to more people. Well, I think we take the governor's direction and respect that he's weighed all the information given to him and tried to make the best choice for society. And so we honor that, and it does introduce challenges, but so did waiting. And so I think he felt that the net risk benefit, cost benefit favored opening things up more rather than trying to string out the phases.
Do you have any estimate on how many people in the county will become eligible tomorrow?
I don't have those numbers at my fingertips. I think it's the addition tomorrow is, I think it's roughly 30,000, but we'll get you a real number and forward that later.
That's a number I remember also is 30,000. Will there be any oversight or checks to ensure that those who aren't eligible aren't taking appointments?
No, self-attestation. Are you eligible? Yes. And then we're just, the direction from the department is to take people's attestation. And that makes a lot of sense. Certainly, I imagine some people are going to jump the line, but I think most people are going to try to cooperate with the plan. And I think we would, introduce inefficiencies by spending too much time on that, especially at the mass sites.
Is there any idea when the county will open more vaccination sites? I know the Edmonds School District is interested in one at its high schools, so future sites.
Well, right now, much of that is the vaccine task force's role, and we're partners there, but not. It's a multi organizational body and decision process. We certainly have thoughts about expanding mass sites as the supply increases, but right now we've got insufficient supply to even max out our capacity at the existing sites. So we're gonna, I think, just kind of stay tuned and see where the supply goes and take it from there.
Yeah. Last question. Dr. Spitters, many states are opening up eligibility to more adults, and Washington is still waiting until May 1st. You said it doesn't concern you that they're not speeding up eligibility here. Why is that?
Well, because we're all of our vaccine slots are still going to get filled up. So, whether it's April 10, April 15, May 1, May 15, I can live with that because the vaccine slots are going to get filled up. We've got more demand than supply. As time passes, ultimately that'll change and it'll make a lot more sense, and the timing of that might be more important. But right now, it's not a driving factor for me.
So just one comment on that. Yeah, our phases are still geared to try to get the more vulnerable the vaccines and get them priority to vaccination. So that's still a worthy goal and one we support. Again, there is discussion at the national level and even the state level about moving things earlier. And if that's the decision, we'll work with it. And one other issue I wanted to mention was you may see some national media coverage about the mass vaccination sites not being very efficient, and I know the administration is looking at prioritizing pharmacies. Well, the mass vaccination sites they're talking about are those run by the federal government, often FEMA employees, National Guard, etc. We do not have a national mass vaccination site in Snohomish County. All ours are have been stood up and are operated locally by the county and the health district. Our mass vaccination sites are extremely effective. They're a critical part to our tool to getting vaccine out. I am a bit concerned at the national level there might be a conflation of the two, the federal sites versus the local sites, and we'll do everything we can to make sure that the local sites are getting all the vaccine that we possibly can get, because they're a critical tool. Not to take away from pharmacies, they're extremely valuable also, but the local drive-through and walk-in sites that we've stood up are well accepted by the public and are being very efficient, frankly. So if you see some coverage on that, don't mix the two up. Thank you.
This is Kristen in the Joint Information Center. Thank you again for joining us today and for your questions. We're going to go ahead and wrap up. Please stay tuned for future media availabilities.